The rate of chronic non-communicable diseases such as obesity, diabetes, and high blood pressure continue to increase among young people in the Virgin Islands. To promote healthy lifestyle behaviors from an early age, government is introducing a Healthy Schools Intervention program in primary schools and held a workshop to train teachers to develop lesson plans which would be integrated into primary schools' curriculum.
The onset of chronic non-communicable diseases such as obesity, diabetes, and high blood pressure is seen in all school population, and I dare say is on the increase. We just have to look at the data from the 2009 Global School Health Survey, which was conducted on children ages 13 to 15 across the territory. 36% of our students are overweight. 63% reported that they drank carbonated soft drinks more than once per day. 62% reported spending 3 or more hours per day during a usual day doing sitting activities, and only 27% were physically active for a total of at least 60 minutes per day on 5 or more days a week. These are serious statistics. We must therefore empower our children so that they can prevent or delay for as long as possible the onset of lifestyle-related risk factors and diseases. Our eating and exercise habits must change. The Ministry of Education and Culture is in full support of this initiative. And as you go through the activities planned for this seminar and those to follow, I urge you to become fully engaged in all the activities. We as educators play a vital role in molding our students and helping them to develop lifelong skills, which will help them to, in turn, make wise lifetime choices.
The Healthy Schools Intervention Program will begin with grades 2 and 3. The Ministry of Education and Culture is collaborating with the Ministry of Health and Social Development to introduce the intervention program during the 2015 to 2016 school year. Senior Technical Officer with the Caribbean Public Health Agency, CARPHA, Christine Bocage, facilitated the one-week workshop.
We're trying to get people to stay away from those sodas. If you know what you're drinking, when we show you, the sodas are loaded with sugar. Half of that bottle that you drink is sugar. And if you leave a soda and you let the fizz go out, what we call in Trinidad and Tobago flat, and you drink that soda, it's very sweet. You know, I mean, the carbonated part of it makes you feel good, you're thirsty and you drink it. But I think we need to come to a point in our lives where we say, listen, we really have to stop these things. It may not be good for the manufacturers, but probably they can start reformulating. They can start making smaller sizes. I mean, we know we have to look at two sides of the picture, the consumers as well as the people in business who need to make money. So we're saying there are some things, the high fats, the high salts, the high sugars. If it is we want to have some of them, let us repackage. We have packages now, and there is hardly a package that says 1 serving. We have to get children to understand that they need to read labels from an early age. When you look at the labels, you see a product and you see 150 calories, and you open the package and you start eating its cookies. Who leaves cookies behind in a pack? They eat all. But if they know how to read the label and they check, they may see there are 2.5 servings in that pack. So the 150 is not 150, it's 150 plus 150 plus 75. And that's a pack of cookies. It has nothing to do with their breakfast, lunch, dinner, and all the other things that they consume. So at the end of the day, we end up taking in a lot more calories that we're supposed to take in. So this project, or intervention, I'm hoping that we can reach the students as well as the parents, the teachers, and the community. If we can form partnerships with them so that we can move forward. We know NCDs or non-communicable diseases like diabetes, hypertension, and so on. And the drive to reduce obesity is not a Ministry of Health thing. So I'm very, very glad that the Ministry of Education is taking the lead role in this intervention.
The Healthy Schools Committee is one of 6 committees established by the Interdepartmental Technical Working Group, which is the coordinating arm of the BVI Health and Wellness Advisory Council that was established by Health Minister Waddy Skelton to ensure the successful implementation of the Chronic Non-Communicable Disease Prevention Strategy. At-large Representative Archibald Christian is chairman of the Technical Working Group.
It's going to be a difficult process because no one accepts change easily. But whatever we are selling on the campus of our public schools has to have a component of a healthy option. So we want to get rid of all the fried foods, all of the sodas, and replace them with water and juices, perhaps even local juices, which have no preservatives in them. At the same conference in Aruba, the Coca-Cola Bottling Company was very present. And they were present because they want to protect their produce in the Caribbean. And they were challenged by us, including by myself. We said to a senior executive of Coca-Cola, you place a lot of emphasis on advertising Coke. Whenever you go to a major sporting event or any event in the United States, and even now in the region, in the Caribbean, Coca-Cola is featured on billboards, and they're telling you when you're thirsty, drink a Coca-Cola. And we said to the executive, you also bottle Dasani, which is water. Why don't you place the same amount of emphasis on promoting Dasani? Dasani should be displayed at all sporting events, especially sporting events, because in sporting events, you perspire and you need to be replenished. And I'll be honest with you, the gentleman was a little irritated because we said to him, we don't want you to come into the region and promote Coca-Cola if you can't promote water. And you know what was his response? The reason why they promote Coca-Cola so much is because the region, us in the Caribbean, this is the product that we are requesting. And so we have to reverse that cycle. The same thing applies to chips and bagged Cheetos and all the other snacks that our children are using for snacks. They're saying that the region, we as a people in the Caribbean, these are the products that we are requesting, and so they are pushing them to us. So we have to reverse the cycle. We need to replace our snacks with fruits.
The aim of the Healthy Schools Intervention Program is to improve diet and physical activity patterns by instilling knowledge and skills and providing motivation for adopting these behaviors. The Healthy Schools Intervention Program will be executed in phases and will eventually be implemented in the secondary school's curriculum.